Thank you for joining us for our member showcase presentation. This is part of the programme where we highlight some of the great work happening within the sector. Today's showcase will feature Whittington Health NHS Trust, which, as you know, is in North London. We will hear from the Trust how they've used a unique and innovative approach to integrate aviation safety practices across the Trust to improve clinical teamwork and reduce the potential for human error. We will get an opportunity to view a short animated video in a moment, followed by a presentation by Gillian Lewis, Associate Director of Quality Governance at the Whittington. We'll be joined by Dr. Robbie Lloyd, Emergency Medicine Trainee, and Dr. Mumtaz Mooncey, Paediatrics Trainee, as well as Alex Jolly, Short-Haul Captain, Wingfactors. There will be a short Q&A after the presentation. If you'd like to ask a question, please use the raise hand function at the bottom of your screen to ask your question verbally, or you can post your questions through the session using the Q&A box. Over to you guys.
The National Patient Survey strategy identified human error as a recurring theme in serious incidents in healthcare. Whittington Health NHS Trust found that during the COVID-19 pandemic, furloughed airline pilots who were volunteering in the hospital first-class lounge presented a unique opportunity to integrate aviation safety practices across the Trust to improve clinical teamwork and reduce the potential for human error. As a result, the Trust initiated the Pilot Sim project, where pilots were invited to observe in-situ simulations, providing human factors feedback through hot debriefs and write-ups alongside technical learning. The innovative project had overwhelmingly positive feedback from staff and helped identify latent safety threats, enabling the Trust to learn from the pilot's approach to threat and error management. The simulation has grown in popularity across the Trust, from the emergency department to multiple specialities, including a joint simulation with the London Ambulance Service.
Great. Hello, thank you everyone. First, thank you for inviting us to talk about the Pilot Sim programme. It's something we are incredibly proud of at Whittington Health, and something we also think could be expanded and replicated in other trusts, so we're really keen to share the learning. Firstly, I want to introduce my colleagues, Dr. Mumtaz Mooncey, a paediatric trainee, and Alex Jolly, who's a short-haul captain. See, you guys are hopefully waving somewhere. So the importance of human factors in patient safety education is well known, as evidenced in the new National Patient Safety Syllabus. However, how to teach it effectively in a way that brings about meaningful change in healthcare has been quite difficult. And the aviation industry is usually held up as the sort of gold standard to aspire to. When the pandemic hit, Whittington Health was actually the first trust in the country to welcome the Project Wingmen initiative, which, as you've seen in the video, was sort of a scheme where pilots and cabin crew who had been grounded and furloughed came into a trust to provide tea and sympathy. And I was involved in some of the logistics. And in fact, Alex, I think our first conversations were mainly around sort of fixing malfunctioning coffee machines and also dealing with power cuts from the aforementioned malfunctioning coffee machines. And with absolutely, no disrespect to Alex's coffee making abilities, we were kind of thinking there's got to be a better way to use these sort of aviation gold standard knowledge. And I think, Alex, it was probably around this time last year that you came to me saying that one of our ED doctors, Dr. Robbie Lloyd, had come and asked if you could observe a sim and would that be okay with the trust. And, here we are a year later presenting at the NHS Providers showcase. It's been an incredible journey, and I think it'd be really interesting to sort of hear your perspective on that transition from human factors in aviation to human factors in healthcare.
Thanks, Gillian. Hi, everyone. Well, interestingly, in aviation, human factors training itself has undergone somewhat of a substantial change in the last 10 years. With an increase in reliability and the complexity of our systems in aviation, it's actually getting really difficult now to foresee where the next accident or incident is going to occur. So alongside the inevitable safety investigations that happen after an event in aviation, we're now starting to focus on a finite set of core competencies that mean, in essence, a pilot could, in theory, manage any previously unseen dangerous situation safely. And personally, in my airline, Of the 9 core competencies that make a safe pilot, only one of those is knowledge of technical procedures. So we've taken that approach into the clinical environment. We, of course, don't have technical knowledge, but the beauty of in situ simulation is that human factors is everywhere, from the hospital's dynamic environment through to the teams working with each other who've probably never met before. These mirror the realistic complexities that healthcare professionals face on a daily basis. So both in our hot debrief, that's in situ, immediately after the sim, and also our written reports, we're always highlighting what teams do really well. That's really important. But also in the developmental areas, we like to use aviation parallels to support our delivery, and that ensures a more positive learning experience. We've been blown away by the popularity of the programme, and the WIT has effectively adopted Wingfactors now as their human factors department. As you can see from this timeline, the programme has truly snowballed over the last 11 months to the point where we now have 8 faculties involved, and we've completed over 100 in situ simulations. A nice example of an aviation parallel with healthcare would be, of course, COVID-19 and the fact that healthcare workers are now having to wear PPE all the time. And the importance of clarity of communication is something that pilots, air traffic controllers are taught from day one, that immediate readback of any safety critical instruction. Now, we of course know about the fact that that mitigates threats associated with miscommunication, but something that's overseen as well is the importance of transparency. So everybody on that radio frequency hears when an instruction is given. And we've taken that into the team environment in healthcare, and we're giving teams an opportunity to listen, to hear before an intervention is made. And it just provides one last opportunity for the team to speak up. So that's really how we're approaching all of our sim observations. We're providing clear human factors write-ups with reference to core competencies, and we use our aviation parallels to meet that.
Thanks, Alex. And I mean, I think you can see from that timeline that it's clearly working. It's clearly working well, and it's moving. But I know some of the people listening will say, "But you know, how do you know it's working? Have you been able to is there a way to measure outcomes and effectiveness?" And I think that's where I'll bring Mumtaz in with that difficult question: have we been able to measure success?
Of course. So as with any educational programme, there are a number of different ways to monitor the effectiveness. A key measure for us has been the impact which we've been able to have on patient safety. Through performing these simulations in the real clinical environment with real clinical teams, we've been able to identify latent safety threats. We've then used the hospital DATEX system to report these latent safety threats and worked in conjunction with our quality and governance team to make appropriate system changes. These changes have then been fed back to the clinical teams, incorporated into future simulation, and shaped the learning and training going forwards. There's been a real transparency in the way we've been reporting these latent safety threats. As the slide demonstrates, it's just one example of one simulation focused around traumatic cardiac arrest. As you can see, from this one simulation, we were able to identify 3 different latent safety threats. Having a closer look at number 2 on the slide is the major hemorrhage protocol. Through DATEXing this near miss, we were able to pick up a potential error before it occurred in the real clinical environment. We found through simulation that there was a lack of clarity about how to deal with the major hemorrhage protocol, something which could have potentially life-threatening consequences in the real clinical environment. Picking this up in simulation and making the appropriate changes and feeding them back to our teams has meant that we have been able to prevent harm before it has occurred.
Thanks, Mumtaz. And I mean, it's really clear there's just such clear, real, tangible changes from the programme. But how have staff responded? Because I could imagine, going into a sim and having a uniformed pilot standing behind me could be quite intimidating.
Of course. Well, actually, the reception to the programme has been extremely positive, and having the pilots present has provided a huge amount of energy and enthusiasm, and people have really enjoyed being involved in the programme. Having a transparency in the process which we're using to report these latent safety threats has really encouraged engagement, and seeing the direct impact which we're able to have on patient safety has encouraged people to become involved. Unfortunately, within the NHS, there is sometimes an element of fear around reporting, and people sometimes worry about the repercussions of what might happen if errors are picked up and reported. Through this programme, we've shown that a transparency in the reporting culture and empowering people to speak up has actually meant that this is not the case. Through the programme, we've transitioned to what we would call a just culture. And this is one in which everyone feels empowered to speak up and to activate positive change to have a direct impact on patient safety. As the slide demonstrates, the feedback around the programme has also been unanimously positive. Not only do people feel that their confidence in managing emergency scenarios has improved, but so has their understanding of human factors. There's been a real positive energy around the programme, and people are desperate to be involved in more pilot simulations going forwards.
Thank you. Alex, I mean, what Mumtaz talked about, clearly the presence of the pilots is having a really, really big impact on the sims. I guess my question is this something that's teachable? Because we're, really hoping that in the not so distant future, you will be back flying in the skies and bringing us to lovely exotic locations. So will this project be sustainable when you're back flying airplanes?
Yeah, it's a good question, Gillian. I think there is an inevitability of us returning to flying, although I think the latest forecasts on until 2023 that we reach pre-pandemic.
Don't say that.
But actually, I think more importantly than that, the impact that this is having on the hospital and the pilot team as well, our own personal experiences and how human factors and working with clinicians has changed that and clinical teams. I think it's altered the trajectory of the pilot team's own careers. And we're going to continue with this work even when flying does return. I think that because we put a lot of time into standardizing our observations and collection of data, and we've created a huge virtual library as well with all of our simulations, we've been able to focus on mentoring the staff at the Whittington to become what we call human factors champions now. And that really ensures our sustainability of this programme. I'm pleased to say as well that Mumtaz, who's with us, is one of these human factors champions. And I suppose, Mumtaz, it'd be nice for you to perhaps comment on how this has had an impact on your clinical practice as well.
Of course, it's been an absolutely incredible experience for me being involved with the programme, and it's undoubtedly had an impact not only on my own clinical practice, but also on the shared learning which I've been able to provide to my colleagues. Seeing the direct impact which we're having on patient safety and improving outcomes has been really inspiring. The recent release of the NHS patient safety syllabus actually demonstrates quite well how well aligned our programme's values are to the NHS patient safety. To summarise, having the presence of airline pilots has massively increased our focus on human factors. The identification of latent safety threats in an in situ environment has enabled us to prevent harm before it occurs. And the transparency in this reporting process and empowering all members of the multidisciplinary team to speak up and to activate change has been hugely valuable. The programme not only offers huge spanning benefits in terms of medical education, but also in terms of NHS patient safety across the NHS. Thank you.
Thank you both. And I think we're back over to Ron now for questions.
Great. Okay. Thank you. Really inspiring stuff, isn't it? Very exciting. And thanks to Alex and colleagues for your participation in this. I'm sure everyone at the Whittington is, as Mumtaz and Gillian have been suggesting, have been delighted by what you've been able to contribute. Can I ask, while we're waiting for questions to come up, can I just ask you what were the most surprising similarities and parallels and the most surprising differences that you experienced looking at the airline industry and healthcare?
Yeah, I think so. Some of the parallels, firstly, it's really interesting to see how teams have to follow quite often algorithmic approaches to dealing with certainly high acuity events. And in aviation, we have a similar failure management process. So we have a way that we initially prioritize things, just like healthcare workers do, and then run through this algorithmic approach. And actually, we've been able to share quite a lot of parallels with that. I think also with COVID, the fact that teams are now sort of protecting themselves first with PPE it's very much like we have, let's say, an emergency decompression in aviation. We have to protect ourselves with oxygen masks first, and then we need to prioritize knowing sort of where to find checklists, safe flight path of the aircraft, just like the safe path of the patient as well. So that's certainly a really nice parallel between our two worlds. Some differences, I would say that in aviation, we're definitely more focused on knowing where to find information as opposed to academia of knowing what the information is. And I think that's just a slight difference in the way that sort of training has gone in aviation to healthcare, perhaps. And so I think something that we've tried to sort of instill in the program with working with the healthcare professionals is that actually it's okay not to be right all the time, and it's okay to know where to find the material. And actually often the case that increases this situational awareness of the whole team as well, because you're not keeping your knowledge inside to yourself, you're sharing that information with the team. So, but again, there are so many similarities. We use checklists, they use checklists. So there's been lots of shared learning, and we've learned a lot as well from healthcare workers. I mean, they're incredibly calm under pressure, and that's something that I've learned myself personally.
So Gillian and Mumtaz are going to work with you next.
Yeah, that would be great. Why not?
Can I ask Gillian and Mumtaz whether they found this applicable right the way across the hospital, or were there certain functions, certain areas of work which it was less transferable because they are just so complex? There are certain elements of healthcare which everybody acknowledges are probably the most complex in the world, really, because there's so many different interfaces coming in. Did you spot somewhere that it wasn't quite the same, as useful or helpful?
Sorry, I'll let Mumtaz go first. If you talk about the hospital, I think.
I think part of the beauty of the programme is that because there's been so much energy and enthusiasm around it, people have been desperate to have the programme in their departments. And as we talked about in the presentation, we've sort of expanded to lots of different specialties. But even within each specialty, we've been able to expand into different areas. So, for example, within paediatrics, we've done neonatal, we've done some simulations on labour ward, but we've also had a big focus on child and adolescent mental health as well, and looking at some mental health simulations, which has been really interesting. I think there definitely is scope to expand the learning to many different areas, because human factors is, of course, applicable in lots of areas. And I think a real big advantage of the programme is that we've encouraged multi-specialty learning as well. So there's been a lot of simulations which have involved a number of different specialties, particularly in the emergency department with anaesthetics, etc. And I guess maybe Gillian wanted to talk a bit more about the potential of expanding to the community as well, and looking at how this can be incorporated into community services.
Yeah, absolutely. Whittington is an integrated care organisation, so everything we do, we're always looking at how can we adapt it to different settings, and that's very much the plan for sort of this month and next year is how do we get this into the community.
You talked in your presentation about extension outside the Whittington, and I think you mentioned the LAS involvement here. What's your aspiration in terms of broadening the impact of this initiative?
Who wants to take that? I can start. If you want me to,
go for it.
I can't see anyone else on the screen, so it's quite difficult. Sorry, I'm not sure.
Yes, same.
Don't worry.
I think we obviously feel that this has huge potential benefit, not only in medical education, but also in patient safety. And arguably, that's something that everyone should have the chance to benefit from, regardless of which trust they're working at. I think in the shorter term, we would consider going to different trusts and rolling out the programme in a similar way that we have done to the Whittington. But potentially in the longer term, in order for this to be incorporated into training for multidisciplinary teams, it would be really incredible to have some links or some involvement with organisations such as the Resuscitation Council. And if we're then incorporated into training programmes such as ALS, which everyone has to do as part of their training regularly, then that means that everyone's benefiting from human factors training on a regular basis throughout their training. And it's also reaching the wider multidisciplinary team as well. So I think there's huge scope and huge potential to expand further.
Great.
Yeah, and I would add, just I think that the beauty of this project is, or this program, is how adaptable it is. So we really want to show that human factors isn't an add-on. It can be completely embedded into existing training practices, which is how it's done in aviation, rather than a sort of separate human factors training that's is seen as something that's not integral. And a bit like Mumtaz was just saying, if there's anyone from Health Education England who happens to be listening, that's what we really want everyone to be doing this project. So come talk to us, and we'll see how we can roll it out.
Right, good advert, Gillian. Well done. Okay, I should let you guys go. That's really exciting, and more power to your elbows. It's been fantastic hearing you, and hearing your enthusiasm, I have to say, as well, which is shone through. One of our colleagues has just posted, it's really great to see a positive outcome of the pandemic that probably wouldn't have come about otherwise, which I think we would all share. That's great. So thank you ever so much for sharing that with us, and good luck for the future.
Thanks.
Bye.
Thank you.
Thank you very much.